now more with developing news in regards to the coronavirus. There are over 30,000 confirmed cases in New York City and more than 1,000 deaths being reported due to coronavirus. The governor, Andrew Cuomo, has announced New York State shutdown. It'll be extended at least 2 more weeks in efforts to fight the spread of the coronavirus. The governor also issued an executive order, quote, to put New York on pause, an acronym for Policies Assure Uniform Safety in Everyone. That's been extended to April 15th. All non-essential workers should stay home. Schools will remain closed and all large gatherings will be banned until that date. The governor stated that the pause order will be reevaluated every 2 weeks going forward. The measures the state is taking to expand its hospital's capacity with both the Javits Center and Manhattan opening its 1,000-bed makeshift hospital and the 1,000-bed USNS Comfort also arrived in New York City on Monday. Well, during this pandemic, many former substance abusers are not able to receive the adequate treatment because of COVID-19. Our Bronx reporter, Darissa White, brings us the story.
It's been weeks since President Trump declared a national emergency in response to the spread of COVID-19.
I am officially declaring a national emergency. 2 very big words.
In that time, we've seen the world as we know it shut down, as we're forced to isolate ourselves. For some, isolation can be daunting, but something you can adjust to. But for others, like people with a history of substance and opioid use, isolation can mean life or death.
If you're a drug user and you're isolated at home, you have several problems. One of them is you may go into drug withdrawal if you can't get your drugs.
Dr. Samuel Friedman is a research professor at the NYU School of Medicine, Department of Population Health. He says isolation will drive some drug users to extreme lengths to prevent the side effects of withdrawal, which can ultimately expose them to the novel coronavirus.
Some of them may end up getting arrested, in which case they're going to both be in withdrawal, and unless something's done to the jails and prison, they're going to be in horrible risk for coronavirus, because those things are going to be like nursing homes. Some of them already are.
According to a 2018 study on rats published by the National Institute on Drug Abuse, when given the option to interact with other rats or ingest heroin or methamphetamine, quote, the rats consistently chose the social reward. Another concern for drug users besides isolation during COVID-19 is receiving adequate care. Dr. Friedman says some are homeless and are unable to gain access to clean syringes or naloxone in the event of an overdose because of a shortage of medical personnel.
The more serious problem is all those people they have no protective equipment at the moment, and they are burning out.
The Substance Abuse and Mental Health Administration released a statement urging many outpatient treatment centers to use telehealth and telephonic services. Mary Callahan, Senior Director of Outpatient Services for Odyssey House, says her treatment center, along with many others, are using telehealth in the interim to prescribe Suboxone, a drug which diminishes the effects of physical dependence to opioids, such as withdrawal symptoms and cravings.
Someone who has previously been prescribed, and we can confirm the prescription online, so the doctor has the ability to do that, also already prescribed it, we are continuing to prescribe our patients.
Callahan also suggests for drug users not to isolate yourself completely during this time. Instead, reach out to support hotlines such as theirs. Reporting for BronxNet, Darissa White.
And thank you, Darissa. In other news, a field hospital is being built in Central Park's East Meadow, and that's to expand Mount Sinai Hospital's capacity as New York City hospitals are grappling with patients coming in sick with coronavirus. Mount Sinai is building the 68-bed facility with the help of a North Carolina-based evangelical group called Samaritan's Purse. The Central Park Field Hospital is the latest example of efforts to expand hospital capacity at Mount Sinai and at hospitals throughout New York City. Mount Sinai is also repurposing lobbies, as well as other public spaces at its Upper East Side flagship into patient pods that can be up and running in the coming weeks. City parks are also in the mix. City parks such as Central Park have not been shut down, and city and state officers are encouraging New Yorkers just adhere to social distancing measures implemented to combat the spread of the coronavirus. Mayor Bill de Blasio stated during his Sunday briefing the fines will be $250 and $500 that could be given to people who show blatant disregard to social distancing efforts and ignore police officers who attempt to remind people of following distancing rules. Well, stay with us because BronxNet will continue its ongoing coverage of coronavirus 19 and how it's affecting the Bronx and New York City. Coming up after the break, we're going to talk with some elected officials to find out with boots on the ground how they're dealing with COVID-19. That and more on Open right after this.